Well, first of all, I'd like to welcome you to Hoag's open house. It's a virtual open house. We're very excited to have you here with us. Hoag Addiction Treatment Centers has been around for over 30 years. The name has changed. People probably know us most as the Chemical Dependency Unit, or CDU, but our official name is Hoag Addiction Treatment Centers. Very few hospitals have addiction treatment units on campus, and so this is one of the things that I think separates us from most hospitals in this area, is that we have the ability to have someone that's come to the medical floor for some reason, perhaps it's pneumonia, but then eventually come to the detox unit to treat their underlying substance use disorder. Following detox, we have a residential treatment center called Solmar, and this is very unique as a hospital setting. It's technically a residential treatment center, and as such, we have our clients then stay for up to 30 days here in this facility. And then we can transition to outpatient services. So you might hear outpatient services described as partial hospitalization or intensive outpatient. They're slightly different in terms of the amount of hours that a patient would stay in treatment, but essentially it's part of a continuum of care. So one of the things that we're very proud of here at Hoag is that we can offer a continuum of care, starting with detox, then residential treatment, and then finally outpatient treatment.
Every patient coming into the residential program will have a comprehensive psychiatric evaluation. Also, every patient coming into the outpatient program will have a comprehensive psychiatric evaluation and ongoing treatment as indicated. For detox levels, certainly if we're seeing a lot of psychiatric contributors to the use disorder or there's behavioral disturbances, those patients too would have a full psychiatric evaluation. And often we find we treat people at their worst, and so we're seeing a lot of dependence on poor coping techniques. Some of those can be traits in line with a potential borderline personality disorder, narcissistic personality disorder, and part of my job is helping train staff and to interact with patients in a way that meets their needs while taking into account these maladaptive coping techniques they have. With the psychiatric services we offer, we're targeting those contributors to the addictions, because there's so many different things that do contribute to an addiction, be it genetic or other contributors, that we want to make sure be comprehensive in how we approach patients.
We certainly treat individuals that have been abusing fentanyl as well as any other opioid, benzodiazepines, marijuana, stimulants, whether they're prescription stimulants or something like methamphetamine out on the street. But we have patients that come in that have been using all kinds of substances.
Often psychiatric conditions that we do treat, both in detox, in the residential level, and in the outpatient programs might include your generalized anxiety disorder, certainly major depressive disorder, bipolar disorder. If someone's not in a severe manic episode, then we would definitely treat that on the units if they're maybe hypomanic or in a depressive component of bipolar disorder. 5150 hold is a legal psychiatric hold for someone if they're a danger to themselves, danger to others, or gravely disabled. And we don't treat those individuals on a hold on our units or in the residential program or in the outpatient programs, but we do help facilitate them getting into an inpatient psychiatric unit before then accepting them back into our programs.
Currently we're seeing up to 20 consults a month, and we're finding that we're able to help with reducing code grays, identifying people in withdrawal, and thus able to treat them more effectively and provide them with appropriate referrals moving forward. A few insurances are difficult, and that would include CalOptima, Medi-Cal, but Medicare is definitely covered in the detox unit. Thank you very much for coming to visit us here at Hoag Addiction Treatment Centers. We're very grateful for the time you spent getting to know us and our program. We look forward to working with you in the future, and I just want to say it's been a pleasure getting to know so many of you and working with you as part of the consult service, and we look forward to working together for many years to come. Thank you.